Hey, welcome to episode number 14 of the Go To Physio podcast. In today's episode, we're talking about the importance of the fingertips to common rotator cuff exercises. I hope you enjoy the show. Hey, welcome to the Go To Physio podcast episode number 14. And what we're talking about today is the importance of the fingertips to rotator cuff exercises. Now, in the past few episodes, we've talked a lot about the importance of the foot, the knee to the hip joint, the importance of the distal hamstrings, proximal gastro to allow the hip to do active work. What we want to do today is we want to switch to the upper limb now, and we want to start to look at the importance of the hand and the elbow to shoulder health. So again, this is a different way of maybe looking at the body, certainly to how I was taught in university. So I appreciate your open-mindedness in today's episode. Give it a try with some of the recommendations that I'm going to make today, some of the tweaks that we use, and see what you think in clinical practice, because as always, the aim of these episodes is to help you get real world results with real people in the real world. So when we made the change and we started to look at physiological principles of human movement, we looked at architecture of muscles and started to get that picture of maybe how we should be designing our treatment plans and rehab plans. When we apply this to the upper limb and the Go To Therapist mentorship, I'll be honest, I was quite amazed. And I think personally the module 3, which is the upper limb assessment and treatment, for the upper limb, I think that's the best module, and that's my favorite module in the Go To Therapist mentorship. And I was quite astounded at how easy, so to speak, shoulders became once I started looking at the importance of the hand and the elbow. So when we look at movement, we can see that obviously when we go to move our limb, it's always driven by intent. So, if you're going to reach your hand overhead, to reach for something over in the cupboard, etc., you don't do that by trying to isolate your rotator cuff, isolate your lower traps, your serratus, your deltoid. What you do is you reach with your fingertips usually, okay? So things usually start with the hand, okay? And everything else is reacting to that. So that's where we need to, in my opinion, with shoulder exercises, is give the nervous system, give the brain an opportunity for the fingertips to communicate with the elbow, to communicate with the shoulder. So when we see traditional exercises targeting the rotator cuff, let's just have a quick look at maybe the sideline ER external rotation exercise that you might do with a dumbbell or a TheraBand. Okay, so when I've used these and odd time I still do use them, but when I do use them, I'm very, very careful with my cues, and I want my intent to be very, very specific, which again we're going to talk a lot about in depth today. So when we do that exercise, usually two big cheats that I see patients do that they don't do this exercise very well will be when they're in that sideline position, is to get the weight up, they'll usually do excessive wrist extension. Okay, so instead of driving genuine ER, okay, at the glenohumeral joint, they'll usually wrist extend first quite a bit, and then drive a lot of that motion through wrist extension. The other big cheat that I'll see, or maybe excessive motion at a certain area where we may not want it to be, will be the scapula. So the other kind of big cheat that I'll see, instead of genuine glenohumeral joint ER or active work being done at the shoulder joint in the transverse plane, is excessive scapula adduction. Okay, so again, we can get that weight up by excessively adducting the scapula, and also doing a lot of work with the wrist extensors. Now, that obviously isn't ideal if we're trying to get genuine load through the shoulder joint. Now, why is the nervous system not happy to put load through the shoulder joint? Is that due to pain? Is it due to perceived threat? Whatever. But what we want to ask ourselves is there maybe a better way that we can get these exercises with some simple changes that can adhere maybe to physiological principles, and that can maybe give the nervous system and the brain an opportunity to work these tissues in coordination as they may do, or in synchronization, so to speak, for want of a better word, that they do in real life. And that's where then we started to, as I said in the mentorship, when we looked at the upper limb, we started to appreciate the importance of the foot, the knee, and the hip, that we started to look at the hand, the wrist, the elbow, and their importance to the shoulder joint. So just like the foot and the proximal gastrodistal hamstrings are very important to obviously delay knee extension to allow the hip joint to do active work, we can see that the wrist flexors and the ability to co-contract at the elbow joint is going to give us a great opportunity to do genuine active work at the shoulder joint, and particularly the deltoid. So if we substitute the glute max for the deltoid, we can start to see then that there's very, very similar muscles like the bicep and tricep with the quad and the hamstring, the wrist flexors with the gastro, so to speak. Okay, and again, if we just go back to fundamental movement, we can see that when we're crawling, the wrist flexors and not the wrist extensors are vital. Okay, so again, we've got these long tendons designed to transfer energy. Okay, so again, when we're crawling, etc., the wrist flexors are taking a lot of elastic energy. We've got these long tendons that again are designed to do that well for energy efficiency. So when we look at handoffs in rugby, okay, again, we're using the wrist flexors. Okay, when we look at gripping, the wrist flexors become very, very important. Whereas a lot of the ER exercises that I see happening in shoulder rehab, we're losing an opportunity to use these muscles by maybe excessive wrist extension or excessive scap adduction. So a simple tweak to that, so to speak, is having intent. And again, remember, movement starts with intent. Is having the intent to move the load or move the weight from the fingertips. So instead of just lifting the weight up, we're pulling the weight with our fingertips. So again, you're getting that light squeeze, which again we appreciate will fire up the rotator cuff anyways. But in that sideline position, you want to be pulling with the fingertips. Okay, so you'll always lead with the fingertips, and the nice thing about that then is that's going to straight away, it's going to kind of negate the wrist extension cheats. But also what you'll find is that you can't essentially actively adduct the scapula, okay, while you're doing the motion by driving through the fingertips, because you'll almost be driving a wrist flexion moment. So you'll kind of get limited with the ability to cheat. Okay, so when you pull with the fingertips, we're getting a unique opportunity to drive that motion, okay, get the wrist flexors involved, and communicate with the rotator cuff and the deltoid. Hey, I hope you're enjoying today's show. For more clinical content and tips to help you implement this content in the real world, please visit thegotophysio.com for more information, including my 6-step patient adherence checklist, which you can download for free. And also there's more blog content that helps you implement this stuff in the real world. You'll also find links to my YouTube show, The Go-To Physio Show, as well as lots of more information to help you become the go-to therapist, helping real patients get real results in the real world. Now, obviously, the big thing we need to ask ourselves, okay, is why is that rotator cuff painful? Why is it inhibited, etc.? Why is it becoming overloaded? Why is it becoming torn in the first place? Okay, and again, you know, that's such it's an important muscle, but why is it becoming overloaded, painful, inhibited in the first place, weak, whatever you want to call it? Okay, and that's where we have to start looking at what's not doing its job, and that's what we do specifically in the Go-To Therapist mentorship, with our assessment especially, is we look at what's not doing its job. When we can find what's not doing its job, then very often we can see that these tissues will fire up very, very quickly again. Okay, because I appreciate what people are trying to do with these shoulder, rotator cuff exercises, but what happens when, we fire these rotator cuffs up again, but we haven't addressed what's not doing its job in the first place. We still haven't addressed that true problem. So is it any kind of wonder that a lot of these issues will reoccur again? Okay, so what we do in the Go-To Therapist mentorship is we still appreciate, the 20%, which will be the symptoms. We still need to do our traditional stuff for that to settle the symptoms down, get everything fired up. But what we want to spend 80% of our time with is finding what's not doing its job and giving a step-by-step graded exposure program to show the nervous system, the brain, that it's safe to tolerate loads in these areas. Now, for the vast majority of people with shoulder issues, we're going to spend a lot of time in places elsewhere besides the shoulder. So again, we'll get a lot of people come to our clinic who've been around the houses. They've been to top clinical specialists in the UK, physios, etc. And they've done everything right from a shoulder point of view, but they may not have found what's not doing its job maybe below it. And again, when we look at the importance of the bicep, tricep, the wrist flexors, we maybe desensitize those with hands-on, and then we start to give that graded exposure program and that step-by-step exposure. Then things change very, very quickly. And as I say, common things like impingement, maybe slap tears, and bank carts, etc., that don't have gross instability. We can get a lot of these people functioning very, very well very quickly once we find what's not doing its job, and once we give a graded exposure in a step-by-step manner. So that's just something that I wanted to touch on today. I appreciate it's a slightly different way of looking at the body, but as I said, if you can get the intent from the fingertips, I think it takes away a lot of the cheats, and I think you'll be pleasantly surprised with the sensation that you're feeling and the recruitment that you want. Okay, and again, I think a lot of that's happening. You've an intent to pull with the fingertips, and you're getting that subconscious reaction happening up at the posterior deltoid, but also the rotator cuff as well. So that you're not trying to actively or isolate a particular muscle, because I think we all appreciate that that's very, very hard to just isolate one muscle. And I think the transference of that to real life is quite limited. So give it a go. Hopefully that just, as I said in this episode, it's the first time really we've touched upon the upper limb. In my Go-To Therapist mentorship, module 3, it's the assessment and treatment of the upper limb, specifically kind of sessions 1 to 3, where we start to set the foundations, and module 8, it's kind of the high level rehab, especially that we'll be doing with kind of rugby players and Gaelic footballers, etc. And kind of higher level people that need that extra level of rehab, the kind of the high-end rehab. But in module 3, that's my favorite module, and I think that's some of the best work that we've done since we made that commitment to look at the body as a whole, look at the interaction between the brain and the nervous system, look at the physiological properties of the tissues, the muscle architecture. It certainly was surprised me at how as I said, easy a lot of your shoulders become. Obviously you still have that 1 or 2 complex cases, but for the vast majority it really did surprise me. And the vast majority of my attention nowadays with shoulders isn't necessarily on the shoulder. It's not on the rotator cuff, it's not on the rhomboids, the low traps. It's what's not doing its job that's maybe making these tissues maybe painful, have a perceived threat. Why isn't the nervous system generating torque force through these tissues in the first place? That's the higher level question in my mind, and I appreciate it's a different way of looking at the body. I appreciate your open-mindedness to this, and as I said, for more practical demonstrations, head over to www.thegotofysio.com/blog, and you'll see this episode. It's accompanying video with the importance of the fingertips to rotator cuff exercise. You'll see some practical demonstrations there as well if you're more of a visual learner. There's also my patient adherence checklist that you can download, as well as my you can pick up a copy of my book, To Go To Physio. There's also information on my Return to Play course, as well as obviously information on the Go-To Therapist mentorship. If this way of looking at the body resonates with you, if you think this is a way that you'd like to look at the body rather than just giving the same exercises to every patient, to actually be able to make sense of the subjective, link it to the objective, and find what's not doing its job, and then design a step-by-step treatment plan, a great exposure program for that patient, to get them meaningful impacts and make meaningful impacts on their lives so that they can have long-term, long-lasting results. So as I said, that's what the Go-To Therapist Mentorship is all about. It's helping therapists in the real world get real results with real people, and obviously gain that reputation as that go-to therapist while building a very popular word-of-mouth clinic. Okay, so that's it for this week. The first episode where we've started to really touch on the upper limb. We'll have more on that in the coming months. So give it a try, maybe reflect on the cues you're using, get the fingertips involved more with your basic exercises like I show you in the video blog at thegotofysio.com, and let me know your thoughts and how it's working for you. As I said, I appreciate your time and your open-mindedness to this approach, and I'll see you on the next episode. Hey, I hope you enjoyed today's show. For more information, please visit www.thegotofysio.com, where you can download my 6-step patient adherence checklist absolutely free, as well as read the accompanying blog that goes with today's episode. We've got lots of cheat sheets and clinical content to help you implement to get real world results with real patients, that ultimately helps you become the go-to therapist and allows you to build a profitable, busy private practice, or become that go-to therapist in professional sport. I'll speak to you soon on the next episode.